دكتور فيصل أول شيء أهلا وسهلا فيك على دبي and I'm so excited. I can't believe إنه أنت قاعد هذا الكرسي ووراك بكلينكا جويل logo and you're finally
I'm so
here.
proud.
دكتور فيصل is an incredible plastic surgeon, super مشهور بالمغرب, and you are here because you have so many clients that would love for you to see you in Dubai.
Yes.
And I'm so happy to have you with us. اليوم بدنا نحكي عن أكثر من procedure that أنت you have so much passion for.
Yes.
You have so much passion for your work, that's for sure.
Yes.
بس حكينا عن أول procedure بدك تحكينا عنها.
My favorite procedure actually is the endoscopic facelift. Why? Because for me this is the magic facelift. It's scarless. We can do it. It's a scarlet facelift. We can do it in young people and old people. We can change the whole face,
really?
Especially with the ladies with the drooping eyes. They are born like this. It's genetic.
Of course.
Deep drooping eyes, drooping brow, drooping face like this, and there's no solution like threads.
So threads don't help.
Threads doesn't work on this. It works for 15 days and then you lose the effect. Machines doesn't work because machines wound the skin and then that's it. But the endoscopic facelift changed the anatomy from this part to this.
Wow.
And we can combine it with other procedures, especially the deep neck lift. This operation is the deep plane endoscopic facelift. And we can change the brows, the eyes, we can lift the cheek until the jaw. And we can combine it with a deep neck lift, bichectomy, lip lift, upper, lower eyelid, fat
So
grafting.
what do you call this procedure?
Endoscopic facelift.
Endoscopic facelift.
Yes.
And that's without removing any skin?
No. When I remove the skin, when the lady presents skin excess. But I do it at the end of the operation. It's not the same philosophy than a deep plane facelift, because a deep plane facelift you open the skin, undermine the skin, open the muscle, do this, suspend the muscle. In the endoscopic facelift you open the scalp here and do the job under the video camera, and you control the deep plane and then lift everything in a vertical way, and the rejuvenation and the beautification is powerful.
Oh my God.
Powerful.
You got me excited now. You got me so excited for this surgery. Is it, would you say this is an invasive surgery? Like, is the recovery long?
No, what can we should be patient with edema. The bruising, we don't have a lot of bruising because it's a safe plan. We have to know the plan. It's a deep plane. The only thing is the edema. We have to wait between 6 weeks to 3 months. The edema will melt progressively.
What's the edema?
It's the
swelling.
Puffing.
The swelling. Okay, the swelling.
The swelling. Yeah, the swelling will disappear with time, like rhinoplasty.
Yes.
When I do open rhinoplasty, the nose is puffy and the swelling disappear with time.
Of course.
Yeah.
Dr. Faisal, is this something good for men as well? Because with men, when you do like a facelift, it's very hard to hide the scar, much more than women. So is this something good for men?
For men, I don't recommend. We can do endoscopic brow, but it's difficult for men because sometimes we can do feminization of the face because the traction is vertical, and sometimes we change the position of the eyes to give more sexy eyes, and sometimes it gives feminization to the men. So for the men, I will recommend.
Unless there are some men that want to look more feminine,
yes,
maybe.
Yes. In this case, we can do it not opt. It will be crazy result. Yeah.
Okay.
Yeah,
wow.
Absolutely.
So let me just understand this more.
Yeah.
So when you do this endoscopic facelift, so you pull the muscles.
Yeah.
Right.
Pull vertically all the muscles of the face, including the muscles of the brow. We can play with the brow, the eyes, à la carte, au menu. We can play with the brow, eyes, cheeks, and jaw. We stop here because this unit belongs to the deep neck lift. I open here and here.
And what's the age for the endoscopic facelift?
the very.
What's the youngest you've done?
It's 20 years old.
20?
Yes,
Wow.
because she was born. This lady
okay,
was
fine.
born like this. I can show
Okay.
you on
Okay.
my phone
Okay.
some case. The lady was born like this,
Okay.
and she wants to look more beautiful.
Okay.
So we will reveal the beauty with this operation, and it changed lives.
Wow. I'm sure.
Yeah,
I'm
it changed
pretty
lives.
sure.
Yeah.
And what's the oldest you can do it?
We
So,
can.
so do you think that there is a certain age that this will not be enough, that someone needs a proper facelift, or you think it's enough for everybody instead of a traditional
The
facelift?
endoscopic facelift is a different philosophy from classic deep plane facelift, because when I do full endoscopic facelift, the equivalent is broad lift endoscopic and deep neck and deep plane and facelift. This is, but if you do this two operation on two different people, you can see the difference in the beautification. Endoscopic facelift give more beautification.
Oh, really?
More rejuvenation, because the vector of the face is completely vertical, and we remove the skin at the end of the operation. We don't start by cutting the skin. The skin is just refinement. Some people doesn't have skin excess at 60 years old. It's rare, but it exists. They have thin face, sagging skin, sagging muscles, but no skin excess. So I do complete facelift without any scar here,
That's crazy.
because we don't have any skin to.
That's amazing.
It's a deep plane surgery.
I see how passionate you are, because you talk about it like with so much
I
passion.
like so much that kind of
Yeah,
surgery.
because I think you like
because
your results.
I'm very impressed by the result, and when I see the patient, always I say, "Wow, mashallah, that's
Yeah.
beautiful."
Yeah.
And patients are grateful. They send beautiful messages. You changed my life, doctor. I feel more confident. I feel more beautiful. This is why I do this.
Yeah, it's amazing. I want to ask you, if someone has already had a facelift, can they do the endoscopic
Yes,
facelift?
of course.
Yeah.
Without any opening here. I did one two weeks ago. One
I want to
lady.
see photos. Can I?
Yes, you want to see it right now? Yeah.
I'd love to
she
see
had
the photo.
facelift 5 years ago.
Okay.
And she was complaining with the cheeks and the neck. So I do endoscopic facelift without any opening here and deep neck lift. Now the definition is perfect. I
Wow.
had chin implant, bichectomy, endoscopic facelift.
Wow.
It's stunning result.
Wow.
Yeah.
That's amazing.
Yeah.
Okay, so we need to make sure to add a lot of photos to make sure that people understand what we are talking
Yes,
about.
of course. Yes,
Oh, that's beautiful.
Of course. Super straight. It's not the case. It's not the case. Especially in Morocco, we have a lot of thick skin and deviated nose. A lot. So, and we have to fix this, because you can have a beautiful result in rhinoplasty if you don't fix the septum, if you don't give definition to the tip. And with the rib cartilage, I do a small scar under the breast of 2.5 centimeter. I can take a piece of 4 centimeter, and then I use this rib cartilage to structure the nose, to give the nose beauty for the 10 to 20 years. It will not move with time.
I've seen your noses. They're incredible and they're
Thank
so
you.
beautiful. They're like perfect. And I really hate the turned up noses.
Yeah.
I hate the big nostrils when we see the nostrils before we see the face.
Yeah.
I don't like a lot of the work, honestly, I'm saying, of the doctors that just do noses.
Yeah, no.
Some of those doctors just do noses.
Yeah.
They do such tiny noses.
Yeah.
They do such turned up noses.
Yeah, it's not
and-
beautiful at all.
Oh my God, it's so not beautiful.
it's not beautiful.
so not beautiful.
Totally agree, yeah.
But I love the way that you do the nose. So tell me about, if you have a client who's very young and really doesn't like her nose, what age would you accept your client? At what age?
We'll start.
Honestly, because I hated my nose all of my life when I was young.
Yeah.
So I did my nose the first time when I was 20 years old.
Okay.
But I wish I was able to do it younger.
Yes.
What's the youngest age someone can do their nose?
Okay, we can do the nose when the growth is finished, and we can assess it by a X-ray of the hand
Oh, really?
to see the fusion of the bones. In this level, yes. If the growth is finished, it's approximately around 16 to 7 years. 16 to 70 years old. We can start. Sometimes 16, sometimes 17.
Oh, really?
Yes, but because before the growth finish, we don't want to do rhinoplasty, and the nose is going to be more bigger with the growth. So we should be sure that the growth is finished, and then we can perform a rhinoplasty.
Okay, that's incredible. So, what else can you tell us about rhinoplasty, like your special technique?
I like to use piezo surgery, ultrasound. It gives a lot of precision during the rhinoplasty, which means I don't cut with all the instruments. I cut with small instruments. These instruments deliver ultrasound in the bone. The cut is precise.
Wow.
It doesn't bleed, which means people the day after they just have the cast.
No bruising?
Nothing.
Oh my God! I was black and blue.
They can go to the restaurant the next day. Yes, they just have the cast and that's it.
Dr. Faisal, you're incredible.
I don't know, but I do my best for people. I love to do my best for people. And piezo is very good, because
What's piezo?
Piezo, it's ultrasound. It's a small instrument.
Yes.
That it delivers ultrasound, and you cut the bone with this. So there's no.
They used to hammer before.
Yes, before I used hammer, but it sometimes it provoke a blast in the bone. You know.
So thank God for technology.
And the day after, the people are not. You cannot recognize with the puffiness, with the bruising and.
So with your rhinoplasty, no bruising.
No, the day after there's no bruising.
That's amazing.
There's nothing. It's improving of the aesthetic result and the function, because sometimes the breathing is difficult because we have swelling inside the mucosa of the nose, but it will disappear with time. It's just squish. Should be patient in life.
Yes, of course.
Endoscopic surgery, no surgery, face surgery. Just wait for the
final result.
Yeah. Absolutely.
Amazing. Dr. Faisal, I love doing those videos with you because honestly, every single time I've learned something new. We were just talking about body contouring, and you said I do rib remodeling.
Yeah, rib modeling.
What is that? Do you like remove ribs?
No, never.
Oh.
Rib modeling is a new technique in body contouring, especially when the shape of the woman is square.
Yes.
So when the shape is square, even if you do good liposuction of the back and love handles, the patient will not have that beautiful shape, especially in the waist.
Yes.
So this is waist surgery. So what we do, the 3 last ribs, 10, 11, and 12, we model the ribs, which means...
Really?
Yeah, the ribs are like this.
Yes.
Okay, we do small puncture in the bone and turn the rib.
Oh my
10,
God.
10, 11, and 12. And we do it...
This is crazy!
In the left and right side, and you can lose 6 to 10 centimeter in the waist.
This is crazy.
Yes, this is crazy.
I think this is what the Kardashians have done for sure.
Yeah.
Oh, for sure.
Yeah, definitely.
Wow.
To have good, because.
And is it painful?
No, not at all. But you should wear the corset.
For how long?
3 months. This is mandatory, because if you don't put the corset, you will lose the effect. Sure, because you should. The corset has.
So no pain.
No, it's not painful.
Wow.
It's sometimes difficult to wear the corset all the day for 3 months. But it's the only way.
And is it like the medicated corset or stronger corset than the medicated?
This is a corset that is special for that kind of surgery.
Wow.
Like you wear it just above the garment.
Wow.
Yeah. So sometimes it's difficult to wear the garment and the corset. Okay, this is the difficult part, but it helps for the result. Don't wear the corset, you lose the effect.
Can someone just do that, like without liposuction and without tummy tuck? If someone wants to come to you and they are thin already, they're slim,
we can do it.
But they just want that incredible technique.
We can do
they
it.
Can?
Yeah, we can do it. Yeah.
Wow.
Yeah, you can
And
do
how
it.
long does that take in surgery?
Not that long, half an hour.
Oh
It's
my
15
God.
minutes per side just to take a. It's scarless because you just do.
The Faisal, no, I want to do it. Oh my God.
This is beautiful. For the body reshaping, I think it's a game changer.
Wow.
Because even if you do a very aggressive and beautiful liposuction of the back, you cannot change the back.
No, of
the
course
shape.
not. Yes.
And you can improve the waist by doing this.
And there's no danger in doing this. There are no like side effects.
Okay.
No risk on the lungs.
All the surgeries can
Have a bit of risk.
Yes.
Yes.
We cannot say that if you respect the technique,
Yes.
the complication rate is very low. It's very low. So the most effective side effects is the lack of result.
Okay.
Yeah, if you don't
okay.
wear the corset.
Okay.
But
But it's not danger on the health.
no.
It's not a surgery
No.
that actually
No.
can actually
No.
damage your health in any way.
Not at all.
Oh, not at all. Okay.
Not at all.
Yeah.
And
There's
if you
no-
don't like the result after 1 month,
Yes.
you remove the corset.
Okay.
Because the muscles of the chest,
Yes.
of the
So the
thoracic
corset
bone.
will almost act like a cast, right?
Yeah,
like
absolutely.
like if you break a
Yeah.
bone, then you put your bone in a
absolutely.
cast, and that cast will make
But
the
in this
bone.
technique, you don't break the bone fully.
Yes.
Only the first cortical. I don't know when.
Okay.
The first side of the bone. The
Okay.
other side is completely clean.
Okay.
Yeah. And you turn.
Okay.
You,
Wow.
you break the bone, and you put the corset.
This is incredible. I'm learning so much in this session with you. So, rib remodeling is something that sounds incredible.
Yeah, it's a game changer in
Yeah.
certain type of patients.
Wow.
But
Yeah.
if the waist is beautiful, you do beautiful liposuction and you create curves perfectly. You don't need.
Yes.
In certain case, we can need remodeling.
So, if someone wants the Kim Kardashian waist,
Okay, we can do it.
that's brilliant.